for the introduction, and thank you for welcoming me. I'm happy to be here today. I think you've introduced me enough, but I'll just add that I'm a clinical psychologist, and I graduated from various universities in Europe, France, and Paris more precisely. And when I am from Senegal, Dakar, and when I came back home to work as a clinical psychologist, I found that I had to adapt my frame of thinking and from working in order to be more relevant and adequate in terms of practice, to actually acknowledge the realities of the field where I was working. So it came to my mind that the way I was trained was not actually relevant in my field, and I had to add some more training to be more adapted to my field and more relevant as a psychologist. So where I come from, Indigenous psychology is something that's very prominent. So what is Indigenous psychology? I thought that maybe it was interesting to give a definition of Indigenous psychology before we start diving into this topic. So Indigenous psychology is not a science of the third world countries or primitive people. It's a body of knowledge that's part of a culture before the importation of any foreign treatment or technique. So Indigenous psychology is everything people know about their mind, about the way they feel, about the way they see their emotions, they feel their emotions, and they express their emotions. Everything about psychic development, and that can explain everything connected to mental illness, for example. So in Senegal, Indigenous psychology comprehends theoretical assumptions about where we come from, how we feel, what dreams means, and how we can interpret someone's dreams, for example. And it can also include treatments for some specific representations of mental illness. So Indigenous psychology uses observation derived from the natural world to arrive at different assumptions concerning psychological wellness. And Indigenous worldviews tend to be holistic rather than reductionistic. So Indigenous psychology has a way of understanding the individual in a balance with the environment, not the sole individual and at a personal level. So who are the Indigenous psychologists? The people that we can call traditional healers, for example, are the people who manipulate this science and this body of knowledge, and they are known to be traditional healers. There are some historical facts that I can give you to understand more about Indigenous psychology in different places and countries. So in the 60s, Henri Collomb is the first psychiatrist to have given credit to traditional healers in Senegal. He called them Indigenous psychiatrists, and he worked collaboratively with Lebu and Sera traditional healers. So the psychiatric hospital was created as a place of community, and he would welcome the way people had the habit of curing mental illness disorders, or mental health, disorders. So what he would do was adding another setting as group communication and group work for people to be able to reproduce the same setting they had in their traditional healing rituals. And to understand how people would name and apprehend mental health disorders, he tried to include traditional healers and to learn from them to name some different symptomatology of these people, these traditional healers who were intervening in their own practices. So there's a second point I would like to mention. In the United States, there there has been a lot of research about indigenous psychology, and there is a very important author called Dr. Arthur Bloom, who conducted many research in the state of Washington and some other states in the United States in 2020 and 2022, and he has contributed significantly to the theorization of indigenous psychology in the United States with Native American people. His work centers on the relationship between human and the environment, and he has studied and documented the effect of climate change and the change in nature due to climate change with the people, and especially in the settings of indigenous psychology with Native American people. In South America, there has been a lot of work with Amazonian people conducted by another psychologist called Danilo Guimarães, and he has been working on cultural humility and cultural competence to understand how psychologists were to be trained to be able to be efficient and to do their work as psychologists, but working through the lens of decolonial psychology with Amazonian people. In Asia, there has been research in India and Nepal with many researchers who have tried to implement their knowledge and their ancestral knowledge of indigenous psychology into their own understanding of their work as psychologists and psychotherapists. They specifically documented how to guide the construction of the psychism in connection with what they know about the deities in India, the deities in Hinduism, and how the rituals that parents make and do during the first years of their children can be balancing for the family, for the whole family as a system. So pardon me for this slide, it's very heavy, but I think there are some things in it that I would like to explain before we go further. So Dr. Arthur Bloom, conducting his work in Native American, with Native American people, has tried to, has made this table. I'm not sure you can hear me if I don't, but I'm gonna do this. So he has tried to propose a table documenting how indigenous assumptions can be different than Western assumptions and the impact of these assumptions on the whole way people see mental illness and balance and wellness. So I have used his frame as a basis for my understanding of indigenous assumptions in Wolof, Lebu, and Serer cultures in Senegal. So what we can see here is that all of these representation, the natural world, the reason for mental illness, the relationship with the healthcare system, the implication of family in the treatment, the genealogy and the ancestry, the way people see them in Western assumptions is completely different than the way indigenous assumption has representation. So for example, the natural world in Western assumptions is resources. So you need something from the nature to build a home, for example. You need something from the nature to feed yourself, to be existent in a society, and you can use those resources for you, for your wellness. But in indigenous assumptions, you are part of the nature. So you live with the nature. And you can also observe in the nature some of the information you need to understand the world. So people, for example, will make assumptions based on the nature, for example, the temperature of the water, for example, the way the wind is at a specific moment, for example, because all of these things in the nature are part of an ecosystem, and the human being is also part of this ecosystem, and it functions with the nature. Another point that we can raise is that the relationship with the healthcare system in Western assumptions is that people in the healthcare system, they have knowledge that they have learned. So they went through an education system and they have learned the knowledge to become doctors, to become psychologists, to become social workers. But in another way of seeing Indigenous assumptions is that traditional healers, they're bridges to the invisible world. So they have this kind of sensitivity that allows them to be connected to the invisible world, to invisible entities, and they gain their information from these invisible entities. And about the implication of the family in the treatment. Indigenous healing is community healing. It's collective healing. So the family is part of the treatment. It's about balance. It's not individual treatment. So the family is also sources of observation for the treatment. So people in Indigenous psychology will observe the family to understand the dynamic. Their approach is more systemic than traditional Western healthcare approach that is centered on the individual to understand the symptoms, to observe the symptoms, and to make an assumptions based on the symptoms that are observed. I'm gonna go to the next slide. Okay, so I collected all of this information that was found through research in Senegal since the work of previous psychiatrists and with the research of actual psychiatrists, and made a schematic representation of what is the Indigenous psychology like in Senegal in the conception of Wolof, Lebu, and Therapy. So what we can see on this picture is that we are all we are all originally from the common source of creation. Nature, men, invisible creators, everything is from common source of creation. So in Indigenous psychology in Senegal, from, for example, the perspective of the Wolof and Lebu people, the creator created humanity with other things. Humans are only one part of everything that was created, and they live in coexistence with the other things that are animals in the nature, trees, and everything that is on earth, that is created at the same time. But the reality that's visible is not the only reality. There is another reality that's indivisible. And actually, there is a connection between the visible and the invisible world that I pictured with this line in the middle. And because everything has the common source of creation, humans, they're connected with invisible creators. So in the Lebu culture, humans, family of humans, are connected to family of indivisible creators that are called Raps. And these Raps have families as humans have families. And from one generation to the next generation, they keep their ties connected to one another. And in their rituals, the Lebu have altars, which are big baobab trees, and they have offerings that they give to these baobab trees to preserve this alliance. So mental illness in this perspective is seen as an imbalance, as a representation of something that was not done properly. And it creates a disbalance in the system at large. So rituals involve the whole community to reconnect these bonds between the family of humans and their family of Raps. So in this representation, you can see that there are interactions between the two systems, visible and invisible. So in Senegal, people, when, for example, they will get sick, we will still have this idea of thinking that someone did something to make us become sick. So it means that we have to find a way to understand what it means to be sick. What is normal, what is pathological? How do we feel that we are in balance with our environment, in balance with our generations and our ancestors? So what is very important to remember in that frame is that time and space are different in Indigenous assumptions and Western assumptions. Because the system has a cyclical repetition of time, we do not have this idea of someone who is having a mental illness now is only concerned in the present moment. This is something that's connecting the whole community because the time is cyclical. So if someone is connected to his or her ancestry, the reason for the mental illness can also be cured when speaking or connecting with the ancestry. So it's not something only individual, only present, or only centered on the person. It's something that's about the balance in the community, in society. So this representation of how people are connected with their history, their lineage, their tradition is very important because we need to understand this approach when we are trying to evolve as psychologists, as social researchers in environment where we have to understand what people refer to when they say, for example, it is bad luck, for example, or they need to reinforce family links inside the family, or when, for example, they speak about the future or the past. The Ndup is an example of a traditional healing ritual conducted by the Lebu people in Senegal. There was a lot of research conducted on the Ndup, and some ethnographers have made filmic representations of the Ndup to document the idea and the representation of what mental health is and how the community has an essential role into restructuring its link inside the community and reinforcing the person's support in the family setting and in the community setting to help them feel better after mental health situation. So this ritual is representing how mythical archetypes are present in the traditional healer's work, because the Ndup is a specific ritual in the Lebu community. And the Lebu community is connected to this ancestral history and traditional healing methods. So when the traditional healer conducts the Ndup as a technique, as a ritual technique, they seek the acknowledgement of their ancestors, of their mythical creators who were at the center of their tradition and who can endorse this ceremony. So what is important in the Ndup is the idea that the symbolism of the representation of what is expressed through mental illness, how someone who is suffering mental illness is actually showing an imbalance, not only in themselves, but in their expression of how they feel in their life at this present moment, and how they need the community to point out something that's going wrong in them, in their lives, in the way they feel as community members. So the Ndup, when it is conducted, it's a ritual that centers the individual on how to be connected to their communities. And what is important about it is its symbolism as a representation of how people express their feelings and their anxiety, and also the guilt of being different, of having a mental illness in the community is kind of healed through the ritual, with the fact that the whole community participates in the cleaning, in the ritual. And this event, as the traditional healing ritual Ndup, is the moment where the community participates in the ritual, recentering the person as a part of the community. So I give here a clear representation and definition about what the rap is. So if you have read some of the literature on Lebu culture, there is a lot of research going on about what a rab is. And in the Wolof and Lebu conception, the rab is a spiritual being, symbolizing both an ancestor in reference to the founding ancestor and the pact that enabled the latter to occupy the mythical space. So technically, people would come to psychotherapy and, for example, tell me, I am not feeling well, and sometimes I don't know what's going on with me because I change mind without controlling it. And sometimes I don't feel right, and sometimes I'm sad, but I know exactly what I have. I know I have rap, but it makes me feel anxious, and I would like this psychotherapy to help me with my anxiety. So it feels like psychotherapy is a space where you can only talk about anxiety, and there are other spaces where you can talk about the rap, but there's no connection between both spaces. And my idea was there need to be a connection between both spaces, because there has to be a meaning for this rap connection, in connection with your anxiety. So it means that my place as a psychotherapist is to be able to host this knowledge, this information, to host this capacity of the individual to be comfortable, to be able to speak their mind about what they feel, how they feel about it. So to be able to approach these topics, I was trying to find ways in media to understand how these patients of mine, these clients, would be able to just not think about what's real, what's not real, what I would think that is real or not real, and just be able to work on the symbols of it. What's symbolic about what they say? What does it mean for them to speak of the rap, for example? What is the rap for them? Where does it fit in their mind, and how they constructed this concept of this relationship between having a rap and the rap being the cause of the anxiety? Because someone can say that they have a rap, but the connection and the emotion of the anxiety means that there is an explanation that has to be made in the psychotherapy. So I was interested to know, how do traditional healers work? How do they work? What do they do that make people feel comfortable about going through this path of healing through traditional healing techniques? So they use the media to connect with the mythical flow to the invisible. And I put an asterisk because I want to precise that Guimarães and Bloom have also mentioned this mythical flow as a source of knowledge that traditional healers use in Brazil and Native American people. This idea that there is mythical flow, that the traditional healer, through this process of divination, connects to another knowledge, to another flow of information that's not accessible to the regular human being. And this process goes through a media. They use something, they see through something. So I was interested in trying to identify that point. They seek an explanation for the mental illness in the ethnic mythology. So they try to find an explanation specialized on the idea of the person. So the person would say, I feel like I am tired sometimes, and all of my energy is leaving me. So the traditional healer will look into this information and try to make sense of it. So what is going on in the person's life to make them feel this way? What's the meaning of this symptom of feeling? They do not own the knowledge, but act as bridges to relay it. And that's a very important fact, because in indigenous psychology, traditional healers do not own knowledge. They have access to it. Whereas in psychiatry and in psychology, for example, if it is practiced by an individual, they are supposed to know things. They are supposed to be able to give information because of their knowledge that they have gained through education. But traditional healers, they have access to information. They ask other entities, and they get information through this bridge. So the individual who seeks information uses the traditional healer as a bridge through their own invisible entities. And what do? They make recommendation and give explanation. For example, they will describe what rap are. They will describe why they react the way they react. They will say how this person was contacted by this entity and what happened to make them feel this way. So all of this information to understand how traditional healers work, I've gained them through working and thinking about collecting information from clients who have been seeing traditional healers, and also talking with traditional healers about how they work, what they feel, how they listen to their knowledge, and how they produce it. So what is specific about this model? So the individual is centered into their collective history. So there is less guilt and stigmatization. It's not because of themselves and because of their fault that they're being sick. It's because there is a connection between them and their ancestry and their history. It is because of that that they're being sick. So they do not do something wrong in their own life. So it's less stigmatization for the patient. It provides an explanation that makes sense. So when there is an explanation telling people how they became sick, how they happen to be showing these symptoms, it makes more sense for them to feel better. They seek meaning in culture, ancestry, and rites of passage. And it underlines a connection in time and space. So speaking with psychiatrists and psychologists and collecting information from psychiatric hospitals, I have tried to understand how patients react to classic psychiatric treatment. When they go to see a psychiatric doctor, how they believe the explanation for their symptoms and how they react to it, how they take their medication, and how they actually make sense of the explanation given by the doctor. So since for most of the situations where mental illness occur, it doesn't really make sense for the patient because they don't have the explanation of why they're being diagnosed with this depression, for example. There is no real explanation. People are not really facing a situation where they know exactly why they got this, why they had this other disease. That cannot, maybe it can also be another disease, another situation that they are facing that's not necessarily diagnosed, but some challenge people can face. And the family is not being involved in the psychiatric treatment in any other way than being supportive for the treatment. So they're not being cured with the patient. They're participating in the treatment in terms of accompaniment, but not really being part of the treatment. So because they're not being part of the treatment, they do not necessarily participate in it. So at some point, when the medication is getting difficult to get, when the medication is expensive, when the patient do not have access to the psychiatric hospital, they eventually drop out of the treatment. And treatments are interfering or antagonizing because sometimes patients will try to see the benefits of one of the treatments and then will try to go to another way because they will feel like it's not working. And then both attempts to be cured will be antagonized because sometimes the traditional healer can ask the patient to fast because maybe the ritual is about cleaning. But if there is a medication that's connected to the treatment, fasting may not be possible or may not be compatible. So it can be antagonism. The result may be failure in both treatments. So how can psychology learn from the knowledge of traditional healers to be able to do psychologist work in a context when theories of psychology antagonize reality of people? So psychologists may be able to seek symbols in mythology and tradition. So for example, let's just take a classic example. In classic psychoanalysis, we learn in school that Oedip complex occurs at a certain age in certain types of families and in certain contexts. But this is supposed to be a frame of understanding for a situation. So if a psychologist sees a patient who is a child at a certain age, the psychologist may be observing signs of this situation because he has a theory to support this situation, this conception. So finding another frame of understanding and observing through another lens. For example, there is another way to see mythology than Greek mythology. There are plenty other mythologies that exist. And people could be offered the ability to be observed through the lens of their own mythology, of another way of seeing. So for example, if you think about the mythology of the Dogon people in Mali, the way to see the creation of the womb, the way to see the feminine archetypes of maternity and femininity, and the relationship between the benevolent mother and the devouring mother is mythology. And it's a way of understanding the representation of relationship in the family that could be a frame of understanding mythology when observing someone in a specific frame. And it's another way of understanding to be open to other frames when a psychologist is trying to listen to a content, not from a lens of another science. The second point is to respect the indigenous knowledge, because from the moment when the patient comes into the psychologist's office and the patient feels like he does not have the right to say how he feels about his symptoms, it means that there has a work, there is a work that has, I'm not sure what the word, there is something to be done by the psychologist to make them feel comfortable about saying whatever they want to say, whatever reality it can be. Because what is the matter for the treatment is that the reality that counts is their reality, not the one of the psychologist, not the one of the context, not the one of their own country. Use of media as a projective material has proven very efficient to me in my own practice, because when you use storytelling, for example, you don't have to question the reality. What is true, what's not true. Just find a way to talk and play around the story, and people can actually find ways to express themselves without thinking about being true or false, or being real or not real. And also accept to give value to cultural symbols. So I used an example of someone's history to be able to tell more about how to negotiate between the content of indigenous psychology and the content of psychotherapy. So here we will present a clinical case extracted from a psychotherapy made in Dakar. The client is Marianne, fictional name. She's a woman in her late 30s. She is single and lives with her parents. She was referred by her physician because since she was an adolescent, she has been suffering from multiple physical pains and tantrum crises with no clinical explanations. Additionally, she dropped out of high school after several failures because she had learning difficulties since early childhood. Marianne explains this series of failures by the existence of a male rab who has chosen her and will not let her go. Her schooling difficulties are explained by the fact that the rab is taking her intelligence for her not to succeed. The situation is very hard for her family, as her mother was a school teacher and she never understood her daughter's inability to pursue a normal education path. Her mother being distant, Marianne's father is completely absent, and she regrets it, as she feels like they do not realize how hard this situation is for her. In her social life, she mentions how many toxic friendships with girls who were always jealous of her she has had in her life. And one of them might be the one who invoked the rab on her. Her romantic life is also poor, as men are not showing much interest in her. And since the Rab will not allow her to marry, he drives them away and they always suddenly lose touch with her. It seems like Rab were always gravitating around her, as she is liberal, and they have always had them around the family at every generation. One of her brothers was born with a disability and died at age 20 because of them. So the brother was born with a disability and was never able to speak or walk. And at age 20, he eventually died from another disease. And uncle has shown violent signs of possession and only gained fragile control of his life at age 40. In this context, Marianne is very worried that she will not be able to have the life she wants and that the Rab will maintain her in that dependency to her family. So Marianne, because she did not graduate from high school, she could not go for any kind of studies and she could not have a job to support herself. So she was living at her parents' place. And she was very worried that she would not be able to be independent for one day in her life. During the psychotherapy using storytelling, some images reminded her of key moments when the Rab showed its presence. And it was always when she was feeling lonely and was disappointed by her father's behavior. So using storytelling, Marianne starts speaking about how some of the images and some of the tales that we were talking about reminded her of the fact that her father is not the father she wanted to have, and he was not showing the right behavior in the home. Indeed, he was not behaving as an honorable family man, as she found that he was having affairs and could not tell her mother about it. But psychotherapy is a moment when she gets to openly say her truth about him, as she never allowed herself to do so. Because as his daughter, she cannot think about him with disrespect. So through the storytelling, she found a way to feel comfortable about using this space to speak about this relationship her father had with other women in the household. So Marianne could not talk about this before. And at the moment when she felt like these images were evoking memories she had of her childhood, seeing this, witnessing these episodes that she could not tell her mother about, she started to feel like she was able to speak her mind about what her father was doing and how she felt about him. Through this psychotherapy, where she was relieved from her guilt of not being the right daughter for her mother, having witnessed things that she should not have, she learns to imagine a future for herself and gains confidence. So through the relationship she builds, through the alliance she builds, she tries to find other ways to thrive in her life as an adult. And she builds a stronger relationship with her older brother. So the older brother lives abroad, but she finds in him a protective figure, a positive father, someone who has an image that she wants to keep in her life as a protective figure. And the older brother starts paying attention to her, and he knows that she's having a psychotherapy, so he calls regularly to check up on her to see how she is doing. And she welcomes him into this movement because at the beginning of the sessions, she was saying that he was calling her to know what's going on. Why is she going to a psychotherapist? Why? And she told him that she doesn't want to talk about it and it's her private life. But at some point, she wants to be in a relationship where she can share information with him. And he helps her opening a shop and she starts working eventually at this moment. This psychotherapy did not aim to undermine the traditional healing treatment she was pursuing simultaneously, or disqualify the explanation she had for her problems. So I did not try to find out if there was a Rab, if there was not a Rab, if it exists or not. I tried to understand the symbolism of it. What was this entity? What role was it playing? Why was there an entity in her life from the beginning to play this masculine role in her life? Why was it there? What's the attachment between her and this entity? So building this relationship with her brother as progressively moved this entity to a second plan, to a background, and she was more present actively in her life as a person who was able to do things. So it empowered her as someone being able to face the situation and be active in her position. But rather to offer a safe space to elaborate symbolic references that the rap represented. Indeed, this ancestral spirit acted as a reminder of the law of the ancestors, warning them through her of the loss of cultural values. Being the vehicle of this sanction, Marianne's illness called her family into questioning how they got away from traditional rules. The rap also expresses her anger toward her father for this seductive behavior with other women. Indeed, the topic of other women is a persistent topic in Marianne's speech, because all of the women she has met in her life was aware, aggressive towards her in her way of seeing. She said that many of the friends in school were not nice to her, they were bullying her, and then she did not trust women because she was never safe with them. Additionally, the period of adolescence when the symptoms appeared is a sensitive moment in one's life, and psychological mechanisms enhance her experiences. So I would like to raise a point that's very essential in the introduction of indigenous psychology into psychotherapy. That's the danger of culturalism, and it's something that has been very much experienced in adaptation of indigenous psychology concepts into psychotherapy in the past. So there were previous attempts to take culture into account in psychotherapy, and some others have used these concepts in ethnopsychiatry in France, for example. And the example of the child Nid Koubon in French was abusively used to qualify all children from migration in France that were having mental health issues. Because in this current of trying to understand cultural issues, mental health issues, people in the field of ethnopsychiatry have abusively used this tag to identify these people as not curable by the French classic ethnopsychiatrical system. So there was this idea of psychology or psychotherapy not being able to analyze them and to compartment them in another space that was ethnopsychiatry, and to find another tag that was indigenous to qualify them outside of this present of understanding. So the idea that I would like to point out here is that what's the role of the psychotherapist? Because a psychotherapist should be able to make connection and to make sense into someone's speech, whatever the speech is. So there is a specific calling, naming for some symptoms, but there is a symbolism that you can find through symbols, repeating myself, through concepts, and understand them as ideas that you can transcend in your understanding of the human being. And Nid Koubon concept was abusively used in context where sometimes psychotherapy could have played its role and not have just casted away people from the field of psychotherapy to be put into indigenous field. So sometimes when people say that they have spirits, people will just tell them, just go to see traditional healers, and then that's your thing, because psychotherapy is not supposed to be dealing with this. And this is culturalism, because psychotherapy is supposed to be understanding humanity. If the psychotherapist has to understand the symbolism of cultural concepts, it means that they have to be able to analyze them, to symbolize them, and to elaborate them and make sense for the patient, for the client, into an understanding of healing. Another point is countertransference and IP, and indigenous psychology. So Georges Devreux has made a lot, written a lot of work on countertransference and methodology as a defensive mechanism. So what he said basically was that when researchers and psychotherapists and psychiatrists put a lot of methodology into their work, it's sometimes because they need to put some space between them and what they're watching, what they're seeing. So the excess of methodology means that you're working with your fear of observing the subject and you want to rationalize what you're observing and to put spaces of ways to analyze it through a specific lens of understanding. So if methodology can be a defensive mechanism, when observing something that you cannot understand through the prism of your own methodology, a defensive mechanism could be just casting this thing into a category of something that you do not work with. So mental illness is a challenging topic for one's integrity. So I don't know if some of you work in, have been facing people with mental illness in a psychiatrical setting or in a regular setting, but sometimes it can challenge your mere defenses. Sometimes it can put you in a space where you do not know what's real, what's not real, how to face it, how to understand it. And the countertransference is a mechanism that the researcher, the psychologist has that's reversed from themselves to the patient. And it's the way they feel about the patient that's influencing their judgment on the situation that they are observing. So the indigenous psychology questions our own positions as professionals between Western and indigenous cultures. Because as psychologists from different cultures where there is this representation of mental illness, when working with patients, giving explanation of indigenous psychology to call or to name their symptoms, we are facing the challenge of how to deal with discontent, how to analyze it, how to face it, and how to make sure that our own representations do not influence our answers that we will give to them. And another point is that epistemic violence has left a mark on our minds. So as researchers, we have this idea when facing this dilemma, we have this idea of what's the knowledge that's good knowledge, and what's the knowledge that we know of, that's the knowledge that we keep just as a soundtrack in our minds and do not use as professionals. And storytelling is an intermediate space of elaborative symbolization. That's the way I felt it. Because using storytelling was a relief for me. I didn't have to ask these questions. Is it true? Is it not true? I just had to play with the cards and the stories to make sure that I would become mindful of the associations that it entails, and the patient would be welcome to just share their associations on the images and on the stories. So I just finished speaking briefly about Tamsi's clinical theoretical framework. So to build this, I actually based my theorization on storytelling and how the storytelling was based on African oral tradition and on mythology used to build those things, to write those tales, and what those tales were meaning for the people who would listen to them. And I was interested in seeing how community-oriented intervention is using the same lines than traditional healing, because it involves a systemic approach, using a systemic group of people to be able to connect with them collaboratively. And traditional representation of mental health in Africa are still very important. And this is something that you cannot ignore working in the context of mental health. As a conclusion, I can say that traditional healing is based on beliefs that structure people's reality. Psychotherapy can analyze this reality and use it as a lever for the treatment, because content in the reality has to make sense for the person who is seeking psychotherapy. Decolonizing psychotherapy means working on our understanding of science. What is science? What is knowledge? And accept all contributors to science. Community healing is essential to global sustainability and balance. And indigenous psychology is globally and historically present in all cultures, so we cannot ignore it. We have to work with it. I added a few references if you need that to know more about it. And thank you.
So at this point, we'll open the floor for questions, and I'm going to invite people in the room. If you have a question, you can either come to the front or you can say your question, and I'll repeat it for the audience on Zoom. While we're doing that, though, I've neglected to say one very important thing at the beginning, and that is to thank the sponsors of this event, which include the Department of African and African American Studies, the Department of Psychology, Department of Women, Gender, and Sexuality Studies, Department of French, Francophone, and Italian Studies, and the Office of Diversity, Equity, Inclusion, and Belonging at the University of Kansas. Thank you all for your support. And we have a question. Please. You can come or you can tell me and I will repeat the question.
Let me proceed.
Okay.
Yeah. My name is Umar from Communication Studies. I appreciate Dr. for that discussion. I also appreciate KASC for being part. It was the first time I saw the poster. It's meant for me because it's aligned with my dissertation. So why I have two questions for you. The first question is on conceptualizing indigenous knowledge and indigenous people. So why NGI the cause of indigenous communication? So with that, indigenous people not normalized because of their knowledge that they share. And when we are talking about the concept of love, it aligns with every reminder concept in Islam, gene possession, neutrality, and understanding resources. So I know certainly that a lot of people have been diagnosed with gene possession, neutrality, and it aligns with their mental health issues. Now, can we say that this is also an aspect of indigenous knowledge or knowledge indigenous to movements, whereby the concept of indigenous knowledge? That's the first question. And the second question is more or less like advocacy. So,
Okay, sorry. Let me repeat the first question for people. So the first question sounded like two questions to me. I'm sorry. The question was, what is indigenous psychology? What is the indigenous? How do you define indigenous? And then related to that, this is Rob. Do we understand it similar to or different? Oh, there we go. Go ahead. Yeah, thank you.
yeah, my second question is like advocacy, also similar to gene possession and resources. So we know that in Africa, especially among, not only in Africa, in Asia, in Middle East, and especially among Muslims. So they believe in culture-centered communication as aligns with gene possession is on the lives. And if you look at the SDG on health, is actually that is delimiting the understanding of people of their culture and mental health issues. So how do we, and for instance, this is like a kind of advocacy, which is within the academia or within their need. How can we, beyond their need, beyond their academia, how can we go to Africa, go to these people and advocate that the need for them to understand that, yes, we understand the culture-centeredness of your mental health issues, but we also need to understand that mental health illnesses also go beyond culture-centeredness in the midst of positive forms, not just talking within the academia. Thank you. So maybe we'll see.
Okay, so I'll start with the question on gene possession. the idea of spiritual possession is something that's very present in various cultures. It's not singular to Muslim people, and we call them jinn in Islamic religion, but we call them demons in other religions. We call them other ways in many other situations. And the rituals, there can be religious rituals, but there are other rituals about spirits possessions. So I think that the technique used to fight ritual possession for people who do it, who are supposed to be healing through this media, it depends on the context where you are. It depends on the community where it's made. For example, if I try to picture it in the frame where I work, in the environment where I work, in Senegal, people will say that Rab are ancestral entities connected to people. Jinn are other entities that are spirits that are not historically connected to people, specifically to their families. So it also has a religious explanation, because in Islam, in the Quran, it's written that jinns were here before humans, and the creator created humans after them, after jinns were already created. So in the religion, it means that this idea of jinns was already present in society before they started to implement rituals and religious codes. So that's the way I think I can reply to this question. I'm not sure it fits. Okay, so about Indigenous people. It's true that United Nations has called Indigenous people the people who live in margin of the globalized environment, like the Amazonian people, like the people living in specific places out of the global world. But Indigenous psychology is the knowledge from a culture without knowledge from Western views. In Senegal, for example, what I can say is that Indigenous psychology is what is in the country as a knowledge to understand psychology, to understand the science of mind in the country without the influence of something that comes from outside. There is a teacher that says that, for example, the way psychology is understood, the way the spirit is understood, the mind is understood here in Europe is Indigenous psychology of Europe. But the way it's understood in Senegal, for example, the idea that sometimes our drives or impulses are driven by some spirits that we can have in our ancestry that represent some of the effects we have, some of our nature that we have inside. This is a way of naming our Indigenous psychology. That's an understanding of how we name our states, our ideas of our own mind. So I'm not sure I responded to that. Should I stay for it?
Yeah, please.
Okay, thank you very much for the awesome talk. So my question is, I mean, you have presented the idea of like indigenous psychotherapy because of this instrumental value. I mean, people could talk about their mental health without feeling stigmatized. But what I feel is it not like we're kind of fostering the kind of what I call delusion. I mean, reality is about what is real. And when someone starts to talk about gene, rap, doesn't seem real at some point. But then if we say, okay, we want to base our indigenous psychotherapy on this, and we think, okay, let's try and treat people with that. Though there's an instrumental value, but it doesn't just seem kind of real to me. And how does that present, you know, indigenous thinking or psychology from Africa, or psychotherapy from Africa on the global stage? Sorry, I'm an African person, so yeah. Yeah, so that's my own thoughts on this.
I understand what you say, and I think it's very relevant. Personally, I don't think that we can say for sure what is real and not real. I don't think that we can be sure that there are things that are real and there are things that are not real. If we could, religion would not exist, in my point of view, because there are plenty of things that we haven't seen and we still believe in them, right? So I think that what is most important in psychology is to give credit to someone's speech and to be able to acknowledge what they say and not put pressure on them to think another way. So it's not, being a psychologist is not being an educator or a teacher. It's not a didactic position. It's an accompaniment. So when someone comes with their issues, they have an objective. They come to see a psychologist willingly. They come because they want help with something. And they have a demand. They have to need something. Otherwise, the psychologist cannot come and force the intervention. It has to be asked to come, psychologist. So to understand and to make relevance in the treatment, it means that you're helping someone feel better, but pressurizing the person and telling them that everything you believe is false and your culture has no credit in that. You have to think it this way. I don't think it's therapeutic and I don't think it's gonna help somebody feel better, but telling the person that they can be empowered to make their own choices and they can decide whatever they believe. And if it has to be, if it has to have an impact in their lives and how much impact they want it to have in their lives and what decisions they want to be empowered to be able to make for themselves. So in that, that's where I situate myself. I do not try to find out if it's true or not true. I do not try to disrespect someone's beliefs about religion or about spirits or about anything. I just try to listen and make sense of symbolic interpretation of something. And with these symbols, I try to make sense of the feelings that people have and work with these feelings to make them